Hello friends, today we will discuss one of the important chapter of the dental material as known as dental amalgam. Dental amalgam is an restorative material, color restorative filling material. What is an amalgam? An amalgam consists of a mixture of the two or more metals, one of which is mercury. Dental amalgam consists of mercury combined with a powder silver tin alloy. Mercury is a liquid at room temperature and is able to form a workable mass when mixed with the alloy. Amalgamation reaction. The reaction between mercury and alloy which follow mixing is termed as amalgamation reaction. It results in the formation of a hard restorative material of a silver gray appearance. Composition. The major components of the alloy are silver, tin, copper, a small quantity of zinc, mercury, and other metals such as indium and platinum may be present in some alloy. Now we will discuss about the properties of the components used in the alloy. First of all, we will discuss role of zinc in the alloy particle. The role of the zinc is as a scavenger. The word scavenger is meant to save something. During production of the alloy, when melting of the metal constituent is done in order to make an alloy, oxidation occur, which affect the properties of the alloy and amalgam. Zinc rapidly react with and preferentially with the alloyable gases, oxygens, forming a slag of zinc oxide, which is easily removed. In zinc-free alloys, this thing is prevented by these alloys contain no zinc. Oxidation in these alloys during melting is prevented by carrying out the procedure in an inert atmosphere. Role of mercury in alloy powder. The majority of the alloy powder contain no mercury. These products containing up to 3% mercury are called pre-amalgamated alloy. These are said to react more rapidly when mixed with the mercury. The quantity of silver and tin specified ensure a greater quantity of the silver tin intermetallic compound such as silver and tin. This compound known as gamma phase of the silver tin system is particularly advantageous since it readily undergoes an amalgamation reaction with the mercury. Now we will discuss about the shape and size of the alloy powder particles. The shape and size of the alloy powder particle vary from one product to the another product. Method of particle production filling of the alloy may be cut from a pre-homogenized ignode of the alloy. These lathe-cut alloy powders are irregular in shape and are graded according to the size, being described as a fine grain or a coarse grain. Particle may be produced by atomization. Here, molten alloy spray into column filled with the inert gases. The droplets of the alloy solidify as they fall down the column. Particles produced in this way are either spherical or spheroidal in nature. Alloy etching. Lathe-cut alloy are normally subjected to two heat treatment procedure. The heat treatment involves heating at above 420 centigrade for several hours. The resulting alloy contains relatively large grain of the gamma phase material. The second heat is carried out after lathe cutting. This is a lower temperature treated but typically involve heating the alloy powder to approximately 100 centigrade for above 1 hour. This treatment is referred as alloy etching. It is thought to remove residual stage introduced during cutting and ensure that the alloy remains stable during the future storage. Copper in rich alloy. The properties of conventional amalgams could be improved by inclusion of great quantities of the copper. Newer alloys powder have been some basic ingredient as the conventional products, but they contain much greater concentration of the copper, typically 16 to 30% compared to the less than 6% in the conventional material. These newer alloys are referred as the copper enriched alloy. Production. Single composition copper enriched alloy with a similar shape and size to conventional alloy but contain higher copper content. Dispersion modifier copper enriched alloy. An alternative approach to the is to blend particles of conventional alloy with these of for a silver copper alloy in order to achieve a higher overall copper content. Setting reaction. Now, how the reaction between amalgam and alloy occurs. Mercury diffuse into the alloy particles. Metal undergo amalgamation with the mercury. We have three phases in the reaction. One is called gamma 1, and gamma 2 phase. In um, gamma um, gamma phase we have silver and tin. In gamma 1 phase we have silver and mercury. In gamma 2 phase we have tin and mercury. Weakest phase of the reaction. The reaction of for conventional amalgam alloy may be given by the following unbalanced reaction. We have gamma phase plus mercury, and they produce gamma 2, gamma 1 and a gamma phase. The primary reaction products are silver tin mercury, the gamma 1 phase, and a tin mercury and gamma phase. The gamma 2 phase has a rather imprecise structure. Considerable quantities of unreacted alloys gamma phase remain unconsumed. In copper enriched alloy, there is a replacement of tin mercury, which is the weakest part of the reaction in the reaction product with the copper tin phase. We have gamma plus copper plus mercury in copper enriched alloy, and we get gamma 1 plus copper and tin and gamma phase. The elimination of the gamma 2 phase has a profound effect on the properties of the set material. Properties. Dimensional changes. A small contraction takes place during the first half hours or so. The overall defects may cause a slight final expansion, a far greater expansion than the maximum values given above. The result, if a zinc containing amalgam is contaminated with the moisture during concentration. Zinc reacts readily with water, producing hydrogen. The liberation of hydrogen causes a considerable delayed expansion. A cavity varnish is used in order to facilitate a good marginal seal between amalgam and the cavity walls. The varnish is applied to the cavity walls, and after evaporation of the solvent, a thin layer of the resin covered the dentin. Strength. The strength of dental amalgam is developed slowly. It takes up to 24 hours to reach a reasonable high value, and it continues to increase slightly for some time after that. Spherical particles alloys or copper enriched alloys develop strength more rapidly than the conventional lacquer material. Fine grain structure lacquer product develop the strength more rapidly than the coarse grain product. The tensile strength value of the amalgams are very much lower than the compressive strength. Optimum properties are produced for amalgam containing 44 to 48% mercury. Plastic deformation, known as creep. What is creep? Amalgam undergoes a certain amount of plastic deformation or a creep when subjected to a dynamic intraoral stresses. Creep causes amalgam to flow such that supported amalgam protrude from the margin of the cavity. Fracture causes formation of a ditch around the weakest margin of the amalgam. Restoration. There is a diagrammatic representation of the plastic formation. And the picture one showing that the amalgam filling is done. After the functioning, the masticatory forces applied on the amalgams come out from the margins, and the unsupported margins under the forces may be chip off, and they form a ditch. And there is a cavity ditch. So in this cavity, food debris and microorganisms may appear, and they cause the failure of the amalgam restoration, or may cause secondary caries. Gamma 2 phase of the amalgam is responsible for high value of the creep Copper enriched alloy which contain no or little gamma 2 have significantly lower creep values and are less prone to the ditching. The tendency of a material to creep is measured in laboratory using a static creep test. Corrosion. The heterogeneous multi-phase structure of the dental amalgam made it prone to the corrosion. The gamma 2 phase break down to give tin containing corrosion products and mercury. Corrosion produces a restoration with poor appearance. The level of the corrosion can be minimized by polishing the surface or the restoration. Smooth surfaces are less prone to the corrosion. Copper enriched amalgam perform better than the conventional in terms of the corrosion. Corrosion products produce one beneficial result. It forms a seal between restoration and tooth interface which prevent micro leakage. Thermal properties. Amalgam has relatively high value of thermal diffusivity due to metallic restoration material. The coefficient of thermal expansion of value for amalgam is about 3 times greater than that of the dentine. Biological properties. Certain mercury compounds are known to have a harmful effect on the central nervous system. The planet the patient is subjected to high doses of mercury during placements, contouring, and removing of amalgam filling. Allergic reaction to mercury in dental amalgam, contact dermatitis, splotches of the mercury in a surgery can cause long-term contamination of the atmosphere. We will discuss the next portion of the dental amalgam in the next video. Take care, stay home, and stay safe. Thank you very much.